Welcome, everyone. Thank you for being here tonight. I am glad you all joined us. I'm actually going to turn it over to Erin to get us started. But before I do, I just want to let you know that the Q&A is open. So if you have questions throughout the night, please feel free to drop them in there and we will address them, some as we go, and then some questions at the end. So Erin, go ahead.
All right, welcome everybody. Special thanks to Dr. Paley, who is our medical director and is able to join us this evening. We appreciate you and all you've done to help our school and our community. I'm going to go through the slides. Grandparent Brody will stop me with questions, and then either I will attempt to answer or I'll turn them over to our medical professionals and see if they can help clarify for everybody. And also when I make mistakes. So thank you all for being on tonight. Our mission, really why we exist, we do not have COVID in our mission, which is okay because we'll exist before and after COVID. So this is what we'll talk about briefly for this evening. Hopefully, some or all of you who are on our webinar tonight had the opportunity to read through the PDF we sent out on Friday. We'll attempt to clarify some of that because I know it's a lot of information. And as we experience all the time at school, it's easy to get confused. Some of this is logical, some of it isn't. So we're learning along with you as we go. So thanks for being patient with us. So this is the same as we've had all year. This is similar bullet points to what we shared in our August 9th webinar. And like you, Grandparent Brody, Grandparent Holland, and I are parents of students in the school. So we're living this just like you are. Dr. Paley is living it as a professional in the community. If there's no questions or any comments here, I'll move on. I always want to give a chance for you to read. Okay. These mitigation strategies are the same that we've had last year and this year. If you recall, the vaccination became available to certain adults starting in January of last year, and 12-year-olds and up starting in, I think it was early June. And now here we are, hopefully on the verge of 5 to 11-year-olds having the opportunity to get vaccinated as well. So it is our #1 most effective mitigation strategy. I can't stress that enough. And as I will repeat throughout our brief webinar tonight, at MJDS, to this point, the mitigation strategies are working to great success, which is why there's been limited to no spread of COVID within our building. People are going to get COVID. It is unfortunate. It is impossible to control that. But what we can do is mitigate when people get COVID. And so far that is working well. Vaccination is the best way to continue to mitigate. Dr. Paley or Grandparent Holland, jump in at any time if you need to. Okay, I'm going to give everybody about 60 seconds to read this. It's hard to know how much wait time to give since I can't see anybody. I'll give you another 15 seconds for all of you conscientious readers. Oops, sorry. Well, I'm having some technical difficulties here. Bear with me just a minute.
while you're doing that, Erin, I'll add in that full expectation is the ACIP, or the Advisory Committee on Immunization Practices, will approve this tomorrow, and it gets the go ahead from the director of the CDC, and then they will start shipping it as soon as they can in the next couple days. So that is full expectations from all pediatricians.
Sorry, I'm just having some challenges getting a box off of my screen. Okay,
That's okay.
thank you. All right,
I
let's
can
continue.
add to real quick, if anyone is interested on the MJDS website, we've made a couple of updates. There's really good family information on there. And there's also a link to the ACIP meeting if anyone's interested. I believe it starts at 10 and it goes to the vote till 4. So you don't need to register, but if you're interested in watching or learning, it's on the MJDS webpage.
Thank you, Jamie. All right, so something really important that we want to reiterate, it says it in our mitigation plan, but a lot of this is not up to us. So the mitigation plan we sent out and we can talk about this evening, this is when we hope to implement, but it really depends on the most important part, which is when all school-age children at MJDS are eligible to receive a vaccination. Until that time, we are not making any significant changes to our approach. Hopefully that will happen sooner rather than later. Dr. Paley, anything you want to add about potential timeline?
We're hoping for the next group, which I believe is the 2 to 5 year olds, but it will definitely include the remaining kids in our school. That should come shortly around the beginning of the year. It is not going to take as long as it did to get the 5 to 10 year olds going. So we are all hoping for that in January. They're finishing up the data, and I think they hope to get it all together in a nice packet to start having people read it at the end of December. So again, January is kind of our target date of what we've been hearing, always subject to change.
Thank you. All right, I'm going to continue on. So this is at the top of our COVID mitigation assessment tool, but I want to reiterate it here. So I'll give everybody a second to read it. And when, as we go forward, I just want to reiterate that we're taking guidance from the North Shore Health Department, the State Department of Health, and the CDC. So the information we're presenting you with is, to the best of our ability, reflected in the guidance given by those health organizations. All right, I'm going to jump into the next slide. It's got a little bit more information on it. All right, so on the left-hand side where it says determining transmission risk, the reason we want to share this with you is there is some common language that exists. Most school districts in Wisconsin, the North Shore Health Department, the Department of Health and Safety for the state. On the left where it says determining transmission risk, this is where you can see where we got our boxes, where high, substantial, moderate, and low community spread is coming from. So on the left side, you'll see this is how the math is done. It is reflected in the mitigation tool we shared with you. On the right-hand side, and it is now on our website on the MJDS COVID update page, and it will be updated every week, is the North Shore community transmission level. So you'll look, I know it's hard to see the white, but the blue is telling us the same thing that we're doing at school: stay masked indoors regardless of vaccination. Then the orange below that talks about total new cases in the North Shore. The North Shore does not have the ability right now to provide percentages. They're overwhelmed with trying to limit community spread. And so they're only giving us those hard numbers. If you look at the red box, it talks about the past 7 days in the county. 157 cases per 100,000, that is high. You can see that correlates to the chart on the left. Then in the yellow box, it's the percentage of tests that were positive, which is a different metric. Again, the North Shore Health Department is not able to provide right now, but that is a little bit of a different number. So just want to give you a sense of where things are at as of last week in our community. And Dr. Paley or Garrett Holland, anything to add on this? No, okay.
You did a good job with it, and you can find this on the North Shore Health Department. We're using that. I was telling everybody before that Children's Hospital has on their Facebook site and in their updates what's going on with kids across the state. If people are interested in that, weekly they're putting out that information too, just if you ever want more information.
Thank you. All right, I'm going to move away from this slide. And again, the next slide's pretty chock. The next couple of slides are pretty chock full of information. Again, they are what we shared out on Friday, but I will go through it with you. Okay. So this is a theoretically an easy to read chart, so that we have those text heavy boxes. And then here we have the chart. So I'll give everybody a minute to look at it. I'll point out a couple of things and then see if anybody has questions, or Dr. Paley, Grandparent Holland have any comments. I'm going to wait about another 10 seconds. Okay, what I want to point out is high risk on the bottom, where it's light red, is related to the previous slide with the highest amount of community spread at the moment. And then it goes to substantial, moderate, and low risk. If you notice under face coverings, and again, none of this is going into effect. Any changes do not go into effect until at the earliest in January, once all school-aged MJDS students are eligible for vaccination. Once that happens, then we're going to plug into this. So if the community spread remains high, regardless of vaccination, everybody will wear masks like we are right now. If there's substantial risk, everybody will wear masks regardless of vaccination status. If we are fortunate to get to moderate or low risk of spread in our community, then only those who are vaccinated will be allowed to be in MJDS without masks. They may still opt to wear masks, that is fine, but they're not mandatory. Anybody choosing to be unvaccinated will remain masked, which will protect them from potential spread within the school. The PCR testing is the same as it is now. Isolation is the same as it is now. That will not change. Dr. Paley, Greta Holland, anything to add on this slide? Okay. Greta Brody, any questions, or we keep going?
Keep going for right now. We're going to wait till the end for the one I have right now.
Okay, sounds good. All right, I'm going to give everybody about a minute to read the next slide. There's a little bit more information on that. So something I want to point out here, and if I screw it up, please help me, medical people. Again, none of this goes into effect until at the earliest January, when all enrolled students at MJDS have access to the vaccine. I'm going to keep saying it because it's a really important element. Once people who want to get vaccinated between under 12 can get vaccinated, then you are no longer considered a close contact if somebody near you is positive for COVID. Right now, you're a close contact if you're unvaccinated. So imagine a third grader is positive. Right now, the other third graders have to quarantine. If, however, your child is vaccinated, they are not a close contact. They continue to be in school. There's still things to do to make sure that they are not symptomatic or positive, but they're able to be in school. If you are unvaccinated, you are a close contact if somebody in your class or somebody in school who you are close contact to is positive. That is a significant difference. That's why our staff, if there's a positive case in our school, our staff does not have to quarantine because they are vaccinated. What's going to change for families if you choose to be unvaccinated, which absolutely is your choice, is that if you're a close contact, we will no longer offer virtual live learning for unvaccinated close contacts. If you are positive, regardless of vaccination status, you will still have access to live virtual learning. But again, if you are unvaccinated and you're a close contact, asynchronous work will be provided, but live virtual learning will not be possible. The reason for that is it was a tremendous burden on our staff last year, and it is simply not something that we can maintain, especially when the vaccine becomes available. So I know that's not an easy thing to wrap your head around, but that is how we're going to be moving forward in January at the earliest. Dr. Paley, anything to add?
No, just again, that, right, this is all, we're going to continue to watch and see how everything evolves, especially as we get these kids vaccinated. But we are entering winter, which has always been a higher risk of transmission as we are inside more. So that's one of the reasons we're going cautiously with this. So it gives us time to see what's going on and which direction everything goes. We hope it all goes in the right direction and Delta continues to go down and we don't see any other variants. But we also have to have time to observe this. So we are proceeding cautiously and optimistically.
And what we are not discussing today is in the text boxes of our mitigation assessment tool are lists of activities that might change. So for example, let's fast forward to January and let's be optimistic that community spread continues to go down and that more and more people have access to and get vaccinated. That is where we will make decisions around what activities can be resumed. Can we eat lunch in the cafeteria? Can we resume early care? Can we play indoor sports unmasked with other schools? Can our lower school students engage indoors with kids who are not in their grade? Can they do so unmasked? All of these things are things all of us really want, but we are not going to jump there until we feel it is safe to do so. And I think our track record has been really good over the last year and a half with COVID. So we're all working really hard to make sure that we could keep everybody safe and return to the most normal version of school possible as soon as possible.
Erin, I'm going to stop you. We have a couple of questions about the synchronous versus asynchronous learning.
Sure.
They're wondering, is virtual synchronous learning offered only if the student is positive? And if you could talk a little bit more about when you can get asynchronous versus synchronous learning.
Sure. So at the start of the year, we clarified that. So synchronous means virtual live learning. You are zooming into your class and you're there with your other students during class time. And there's probably some one-on-one time you're getting with some of your teachers over the course of your quarantine or your illness. That will continue for the rest of this semester until we get to winter break for all students who are close contact and have to quarantine. If you are positive or a few other extenuating circumstances, but for the most part, it'll only be if you're a close contact in quarantine or you're positive in quarantine. Once we begin this plan, if you are unvaccinated and you're a close contact, you will need to quarantine and you will not have access to that virtual live learning. Asynchronous work will be provided by teachers, but there will be no zooming into classes, nor will there be one-on-ones with teachers because there simply will not be the bandwidth for teachers to be able to do that while also maintaining a high level of quality education in the classroom. I hope that answers the question.
There was one other question about on this chart about unvaccinated people needing to stay home for 10 days. If you could address the why behind that.
Can I turn that over to Dr. Paley?
Well, let me add real quick, because that's a school mitigation one, and I was going to add that earlier. That was the other change I saw in the question box about the students having to stay home for 5 days. Well, currently the mitigation strategy that we have now is any close contacts in school quarantine for 7 days, and they return on day 8. But the difference is that MJDS with Summit is providing lots of testing opportunities. So we provide weekly PCR testing. As of date, we've done almost 2,500 PCR tests at MJDS. That's a lot of work. We changed the quarantine period to 10 days because we're not going to be offering all of those same testing opportunities at school. It's a safer approach for our students, especially now that we're starting to have students be eligible for a vaccine, because we might not be offering weekly PCR testing on Thursdays, and then again, group testing for all the students who are close contacts. So, the longer period of time, it's longer to see if a student becomes symptomatic. It depends on what the latest guidance is at that time. Some say that you could stay home for 10 days without testing. We may do that, or we may have the students stay home for 10 days and test on day 3 to 5. It just depends on kind of where we are in that situation, but it's really based on the mitigation that we do at school that, we might not be providing PCR testing weekly at that time. I don't know if
Again,
that
all this would start, the earliest would be in January, depending on vaccination eligibility and community spread. And to reiterate, if you are positive, regardless of vaccination status, virtual learning, so live virtual learning will be available. And if your child is not well enough to engage in it, that's okay. But that will be there for you as it is now.
And I think as we move forward too, and as we try to open up more and do more, it's gonna be so important for everyone to continue to partner. And if their kids are sick, if there's an exposure, to really let us know, because the mitigation practices we are doing is why we are doing so well. If you look to some schools more north that do not have as much mitigation practices, they have had to shut down classrooms, parts of the school have had to go to, a couple schools have had 2 weeks of all virtual learning because they did not have the mitigation practices. So they are working for MJDS, and it's being honest and letting us know. And even as we hit flu season, like if your kid's sick, please let them just stay home, get better before bringing any germs in right now.
Thank you, Dr. Paley. Grandparent Brody, any other questions?
Yes, give me just one moment. Keep going, finish up, and then I will get to the next question.
All right, I'm going to go to what I believe is the last slide for 2 really important dates. So the deadline to sign up for our clinic that we anticipate having, it's not for sure yet because it's out of our hands, but assuming that things go as they should this week, the deadline to sign up is this Wednesday. Remember, when you are coming in to get your vaccine for your child, you won't have to wait in line to fill out paperwork. You will have done most of that online. There's a couple pieces we have to do in person, but it should be a pretty smooth process. So you're only coming to the vaccine clinic if you've been emailed a scheduled time. Otherwise, you didn't fill out the paperwork, and as a result, we are not anticipating you showing up. The second shot clinic will be on the date on the screen. And if that doesn't work for you, talk to us and we'll see if we can't support you in some way.
Okay.
Sharing the screen in a second. Grandparent Brody, do you have other questions?
Yep, couple questions here. One is, if the community spread is low in January, would K4 kids who were vaccinated because they were 5 be able to wear no masks while the remaining K4 kids get their first shot, but are still not fully vaccinated, or would they have to keep masks on until everyone has the shot number 2 plus 14 days? And that goes back to how we are not going to change these mitigation or go to this new plan really until everyone is eligible. So it would be that shot 2 plus 14 days.
That was like a really complex word problem, Jory.
Yeah, it was but essentially we're
Great
waiting until
question.
everyone can have it.
Great
But great question. Okay, let me see if I have some other ones. A couple more just came in. Oh, the slide did not say when the first shot is. The first shot is this Friday from 9 to 11.
And you will
all,
be
all
emailed
fingers
your
crossed.
right? And you'll be emailed your scheduled slot, right?
Yep. Yes, the first email said that tomorrow, the next question is, the first email said tomorrow at 8 a.m. was the deadline. They want to clarify that it's now Wednesday. We did push the deadline to Wednesday at noon so that people that had some questions were able to have time to come on the webinar and then give some time to think about it. So yes.
Jory, can I say one other thing about that?
Please.
Certainly, as soon as the vaccine is available officially for 11 to 5-year-olds, we are offering the clinic because our number one priority is to keep kids and staff healthy and safe at school. You do not need to get the vaccine from us. If you want to get it from your healthcare provider, from Dr. Paley, if she's your healthcare provider, that's great. We're trying to make it easy and seamless for families because we are looking to get out of the business of being a healthcare provider. Our business is being a school. We want to get back to that. But until we can feel confident that everybody in the building can be safe and healthy, we're going to do this. So hopefully that ends soon and Dr. Paley can have her business back.
And we come back and say, if the school's offering it, get it there. Logistically, it's going to take us longer to be able to offer it because it has to go through all the bureaucracy and getting to the clinics and having the staff to do it. So we're telling patients, if you have the ability to get somewhere and it's set up, go for it. We fully believe in this vaccine and we think 100% of people should get it, no doubt.
I'd still like to be the liaison to the healthcare partners while I'm at school, because that's traditionally what a school nurse does. So I still want to fill that role. I just want to add that. That's okay.
We have a couple more questions here. The first is, what will the clinic look like? Do they want to know a little bit about what if there are kids that are worried about shots and they see if someone's children are fine with shots, but they see other kids struggle, what would that mean for their kids going forward? Jamie, do you want to talk just a little bit about what the clinic's going to look like?
Sure. So as a parent of a child who's going to go through the same things or at the clinic, what Welltopia does is they bring in privacy barriers, and we have those at school as well. So it will be in the field house. The parents come, we make sure all the paperwork is done. You fill out the COVID card, and then one parent goes up with their child to the vaccination site. You sit with them in this kind of like cardboard area that's closed off, and then comforted, consoled, hand holding. I'll also be on that site, so there'll be lots of familiar faces. And then you'll go over to the chairs that are at the field house for 15 minutes, sit down and time out. And we understand kids are going to still be upset during that time, but there'll be lots of MJDS staff, like Brody will be there. I mean, there's just going to be a lot of staff to help support the children so they feel comfortable.
The next question is, will the school share percentages of students vaccinated, Aaron?
So I believe, unless I'm misremembering, which is certainly possible, I believe that in our August webinar, we shared the percentage of staff and eligible 12 and up who were vaccinated. So we will share again a percentage, but certainly we're not going to share any individual information that is private, but we will share percentages. And we won't share percentages by grade. We'll share percentages for the school.
Thank you. If our family goes on vacation, but all of us are fully vaccinated, will our student be asked to wear a mask for any set amount of time afterward?
No, as long as we are in the moderate or low community spread category. If you refer back to the checkbox document, if we're in high or whatever the one below that is, everybody will remain masked like we are now, regardless of vaccination status. But if we are low or moderate community spread, you will not need to wear a mask.
This one might be for Dr. Paley or maybe the Baird Holland. Sorry, Aaron. The next one says, did the trials show that kids had the same sort of post-vaccine reaction as adults?
Yes, we did see that with the trial with kids. I'm going to bring up the one that no one's asked, but I will bring it up anyways, about the myocarditis, which we saw in our older teens and boys who are between the ages of 16 and 25, I believe. We have not seen that with the kids. And one of the big things that has come out in our studies is that the risk of a child ending up with COVID in the hospital, while small, is still higher than any significant side effect from the vaccine. and that we watch for side effects for the vaccine. So we have a better ability to handle it and do anything with it. But the side effects are the same from fever, achiness, not feeling well, the same with almost any other vaccine that you would get.
I can add to that. We always have stock epinephrine available at all clinics for the off chance that there is a reaction. And Welltopia brings the adult dose and the junior dose epi with as well. And there will be 3 nurses available at the clinic.
Side effects of the myocarditis or symptoms of myocarditis are difficulty breathing, chest pain, shortness of breath. You would definitely know. And again, it is treatable. We take care of it and they do well with it. I will also tell you that just being in our office and the number of people that we have seen with reactions throughout the children's is very minimal. The biggest thing is as with all vaccines is just the kids reacting to it at the time, being more nervous and things like that. There are things you can do. It's the one time I say, give them your phone, let them watch something on the screen to help distract them. You can go on Amazon and order this Buzzy Bee thing if they don't like shots, and it helps help limit, it distracts them actually from the pain. And just you being calm and talking them through that does wonders.
I'll add to that personal experience. I don't know if my kids are on this webinar, but at least 2, if not all 3 of my children had hard times getting flu shots year after year, but we're able to get through it even with tears. And they're oddly excited about getting a shot on Friday. So who knows, right?
I am also all about positive reinforcement. If you need to take them to Starbucks, 3 flavors, give them chocolate, just do it.
The next question is it possible for a grandparent to accompany children for the vaccinations if there's no parent available, but paperwork is filled out for Friday?
I think that could be a yes. The 2 pieces of paperwork that we're still missing for the clinic, one is the EUA for the emergency use authorization for that age group, which we're hoping to get soon, which parents will have front loaded before you come. And the second one is the Welltopia consent, what might look a little different. So we'll see. I think that should be okay as long as the paperwork is signed by the guardian or parent.
Everybody, was there a question that Helen was going to answer?
We had a question just regarding kind of what the stats are now for COVID in our school and where we are now, and we don't release specific information about students or staff members. People wanting to know that specifically. So
that's tricky.
You want to add something?
Yeah, I know that other school districts provide that information to their community. You know, in a community where you have 2,000 plus students and staff, is easier to kind of hide the identity of individuals in that. The nice part of being in a small community school is we know each other very well, but I'm fearful sometimes that by sharing that information, we might inadvertently be sharing identity of those who are COVID positive. It's something to think about. I mean, we want to be transparent, but we send an email saying that there's been a positive case at school. So I can say that I think we have sent 3 of those emails for this current academic year. That's the easiest way I can answer that.
Thank you, Jeannie.
Sure.
Thanks.
But I think in general, right, you could say we've done a good job with mitigation this year. And it has been low. And I will tell you again, the school districts, we see others that do not have the mitigation, their numbers have been much higher and have had rounds and rounds, maybe not as much as last year. Schools in general are doing well, but when you see the mitigation practices in play, those schools have done much better.
And then we'll take maybe a couple more questions. The first one was, will weekly testing still happen once vaccines have been available for all age groups?
Jory, can you say that one more time? You broke up.
Yes, sorry. Will weekly testing still happen once vaccines are available for all age groups?
I know Jamie alluded to that earlier. Do you want to clarify, Jamie?
Yeah, I think it was in the checkbox. I think that once we start getting to vaccine is eligible for all students, and then we are in the low or moderate transmission, we are considering ending the weekly PCR testing with Summit. Do I need to, should I add any? Was that the question? If it's going to continue?
I think so.
Yes, they're asking,
Yeah.
will it continue?
Yeah, so what we have done with substantial and high, any classroom that's considered a close contact, we've offered the whole classroom PCR testing to make it convenient for families and safer for our school. But again, we talked about moving to the 10-day quarantine, and then when vaccine is available, that will start to wind down as well.
All right, Joy, you want to take a couple more questions and then we'll call it?
Yep. They're wondering if trials have started for kids younger than 5.
Yes, and they should be wrapping up in the next, I believe, 6 to 8 weeks.
Okay. And then there was just another question is, what percentage of the school community is participating in the weekly testing?
A large percentage. I wouldn't know the exact number, but I can tell you again, when we started MJDS testing with Summit, I think we were somewhere around 2,300 tests submitted by MJDS to Summit. So a large percentage of our community is testing. And again, I'm going to tell you, the kids are amazing at testing. Some kids look forward to it, but they're doing a very wonderful job. And it's really a nice way to see the kids every day. They're amazing. They do an amazing job.
And so does Summit.
Yeah.
Summit and Wiltopia are incredible partners. I'd say Jamie's relationship that she's built with those organizations are a huge part of our mitigation. And without that, we would be in a very different place.
Yeah.
Right, Jory, are we good or is there any more?
I think we're good.
All right.
Thank
Well,
you.
Thank you, everybody. Again, Dr. Paley, thank you for being on. Gavert Brody and Holland, thank you for being up late. I know this is after Gavert Brody's bedtime, and we appreciate everybody for being on tonight. Reach out to us if you have additional questions. Hopefully you sign up for the vaccine clinic, and we will see you on Friday morning. Have a great night, everybody.